Good morning to everyone. In today's class, we are going to see about the principles of therapeutic and protein hospital diet. I am Mrs. R. Bhavana Indumati, Head and Assistant Professor, Department of Home Science, Sri Sharda College for Women, Autonomous, Salem System. The main objective of this session is about to enable the students to know the principle of therapeutic diets, to understand the classification of therapeutic diets, to understand the routine hospital diet, to understand the special feeding condition. So this is about the content of the today's topic. Next, we are move on to the general consideration. That is principles of diet therapy, advantages of using normal diet as the basis of therapeutic diets, classification of therapeutic diets, and protein hospital diets. So this is the main thing we are going to see. The principles we need to be followed for diet therapy. What are the advantages from the normal diet as the basis of the therapeutic diets? The classification of therapeutic diet and what is protein hospital diet. First, we move on to the introduction. We'll see with the main thing. Dietetics is concerned with the planning of diet in maintaining health, in prevention and treatment of diseases. It is a science and uses the rudiments of principles of nutrition, and it is an art which is concerned with the aesthetic of its services. Diet therapy is mean of use of diet of food and drink, not only in the care of sick, but also in the prevention of disease and maintenance of health. It is concerned the use of food as an agent affecting recovery from illness. Coming to the principles of the diet, a well-planned diet is providing a specific of all nutrient to the body parts, help to achieve nutritionally homeostasis in a normal and healthy individual. However, in disease condition, the body tissue either do not receive proper nutrient in sufficient amount or it cannot utilize the available nutrients owing in body digestion, absorption, and transportation of food elements, thus affecting the nutritional homeostasis of the sick person. The diet needs to be suitably modified. However, it is imperative on the basis of planning, such as modified diet should be the normal diet. Therefore, diet therapy is concerned with the modification of normal diet to meet the normal requirements of the sick individual. Next, the general dietary objectives of diet therapy. To maintain a good nutritional status, to correct the nutrient deficiency which may have occurred due to diseases, to afford rest to the whole body of the specific organ affected by the disease, to adjust the food intake of the body's ability to metabolize the nutrients and the living diseases, and to bring about the changes in the body weight whenever necessary. This is a general option term. Following the principles are not important while planning or important when planning therapeutic diets. We have to follow such principles, types of disease, duration of disease, selection of suitable products to be eaten during the disease condition, case history of the psychological equation, and variety of meals, etc. We'll see one by one. First is types of disease. It is essential to determine the type of disease in accordance to the disease, otherwise it may have adverse effect. For example, low carbohydrate diet can is fibrous food in case of constipation. Duration of diet. Diet should be planned after determining the duration of disease, whether it is short or long. In long duration disease, the planning should not be always to be same to avoid monotony in the diet. Making changes from time to time is very important. The third one is selection of food product suitable to the disease. The amount of type of food should be changed after analyzing the modification required in perfect, which aims at curing the disease. Fourth one is about the case history. So one should know the case history of the patient, about their likes, dislikes, meal timing, economic condition, availability of food, knowledge of cooking method should be obtained, and the diet should be planned accordingly. The psychology of the patient. Diet should be planned and taken care by the use of psychological factor of the patient. His whole personality should be considered as one unit. It is emotional, economic status, social status, etc. Should be kept in mind while planning a diet. The diet of the patient should be planned in such a way that the patient should not feel different from others. The variety and attraction of meal is the last principle. The patient is normally disturbed by his disease. If he given same diet for every day, he will lose his interest in food. Therefore, it is important to add variety to the diet. The food should be more attractive, properly cooked, served, and in a congenial environment. A planned meal should be fruitful only if the patient eat completely. The taste of food is also very important. Next is the advantages of normal diet as the basis of therapeutic diets. It emphasizes similarity of psychological and social needs of those who are well, even though they are quantitative or qualitative differences in requirement, thus ensuring better acceptability. Food preparation is simplified when modified diet is based upon the family pattern and number of items requiring a special preparation is reduced to minimum. Calculated value to the basic plan are useful in finding out the effect of addition or omission of certain foods. Example, if vegetables are restricted, vitamin A or C deficiency may occur. Coming to the factors to be considered while diet planning for therapeutic diets is the underlying disease condition which requires change in the diet, possible duration of the disease to be known. Factors in the diet must be altered to overcome these conditions. The patient tolerance for food by mouth in planning the meal, the patient his economic status, his food preference, his occupation, time of meal, all should be considered. Four attributes of therapeutic diets are adequacy, accuracy, economy, and palatability. Modification of therapeutic diets. The therapeutic diets can be modified in terms of quantity and quality. So when can we can modify by in terms of two conditions as a qualitative and quantitative. In terms of qualitative, restriction of some of the nutrients, for example, sodium in the condition of hypertension and excess of nutrient in the condition of tuberculosis, when the quantitative is increase in the protein energy are required. Coming to the quantitative modification, change in the consistency, for example, the consistency of fluid may be liquid, full fluid, or normal diet. The rearrangement of meals, example, increase the frequency of meal. So we can increase the frequency of meal depending upon the condition of the patient diseases. Mission of food, that is in the cases of allergy, the demand of complete exclusion of an allergic food may be, which causes easy recovery from the disease condition. In the case of patient cannot consume food orally, then they can administer the nutrient to parenteral nutrition route through nasogastric tube, essential to avoid starvation and loss of protein and other nutrient from tissues. A type of changes may be required in the diet is different for different diseases. It's discussed briefly moving. The modification may be in carbohydrate content that the high carbohydrate diet may be indicated in Addison's disease and various diseases of liver and preoperative condition. Hypoglycemia may be present in Addison's disease, while in other two conditions, adequate glycogen store is of considerable value in therapy of this condition. Restricted carbohydrate diet is essential in the treatment of diabetes mellitus. Coming to the modification of protein, the diet which is increased in the caloric value for the treatment of the patient who markedly underweight, the patient with the increased caloric requirement as in fever, infection, malabsorption, hyperthyroidism, low calorie diets are used to the treatment of obesity, cardiovascular disease, acute anemia, and hepatic coma condition. Modification of protein, high diet protein diet is restriction with the nutrient prescribed in a variety of diets such as protein, low calorie, malnutrition of cirrhosis, and cirrhosis of liver, peptic ulcer, and other conditions of nephrosis, celiac diseases, protein of complete or incomplete withdrawal of protein may be necessary with a hepatic coma or acute anemia. So the modification, which is very much essential for each and every nutrient, which should be followed very strictly because each and every nutrient play a key factor in the wellness of the individual. Coming to the modification of fat content, moderately high fat are used in the treatment of severe undernutrition condition. Restricted low fat buffets may be necessary in the treatment of steatopia, malabsorption, and other liver conditions of diseases. Fat in such cases of cardiovascular diseases should be modified and restricted completely, which also improve the individual's disease condition to become normal. Coming to the modification in mineral content, high calcium diet is essential in the treatment of rickets, osteomalacia, and etc. The diet which is restricted in calcium phosphate is desirable in renal calculi. Sodium restricted diet are essential in the treatment of cardiac failure, hypertension, restriction in sodium chloride intake diseases of the kidney. Next, coming to the modification of vitamin content, increased content of the vitamins can be easily achieved by the addition of synthetic vitamin. This is essential as a most of therapeutic diet may be partially lacking of one or more vitamins. Modification of fiber content, diet-rich in fiber are prescribed for the treatment of constipation, while low fiber diet, which is very much essential in the treatment of several gastrointestinal disorders such as peptic ulcer, ulcerative colitis, celiac disease, and dysentery, diarrhea condition, etc. Modification in other nutrients such as low purine content are prescribed in the treatment of gout, while diets low in oxalic acid and purines are prescribed the condition of renal calcium. These are the modifications of the nutrients to be considered. And coming to the modification, the consistency, the most important thing are the liquid diets or oral used in oral feeding and nasogastric feeding. The basis of such diet is milk to be which is soluble carbohydrate such as sucrose, glucose, dextrose, and emulsified fat are to be added to increase the calorific value. Next, the classification of therapeutic diets in different diseases are described in below. First one is belief-based diet. Some people's dietary choices influenced by their religious-based systems may be of their modification to the philosophical, spiritual beliefs. First diet is about Buddhist diet. Buddhism. While Buddhism does not have any specific dietary rule, some Buddhists practices vegetarianism based on the strict interpretation of the first five texts. Hindus and Jain Followers of Hinduism and Jainism of the most followers of lacto-vegetarian diets based upon the principles of ahimsa and which is termed as non-harming. Islamic dietary laws. Muslims follow the diet consisting of solely of the food that is halal, permissible under Islamic law. Kosher diet may be food permissible under kosher set of Jewish dietary laws. It's said to be kosher. Diet should be followed by the Jews and just called as kosher diet. Second one is the vegetarian diet. A vegetarian diet one which includes meat and vegetarians containing, which is the vegetarian is also avoid the food containing the byproducts of animal slaughter and animal derived rennet and gelatin. Fruitarian diet, in that particular fruitarian, which is classified as fruitarian, lacto-vegetarian, lacto-vegetarianism, and vegan diet. So what is fruitarian diet? Which is predominantly consists of raw foods. Lacto-vegetarianism and vegetarian diet, which includes certain types of dairy, excludes egg, and which contains animal rennet. Lacto-vegetarian, the diet, vegetarian diet, which includes egg and dairy. Vegan diet, which is additional requirement of vegetarian. Vegan do not eat food produced by animals such as eggs, dairy products, and coming to the next is weight control diet. Desire to lose weight is the most common motivation the dietary changes to maintain the existing weight. Many weight loss diet may be considered some entail weighing of health risk, some not widely considered the effective. This especially true of crash and fat diets. The weight loss diet, which is further classified into carbohydrate diet and crash diet. Low carbohydrate diet is termed as Atkins diet, Dukan's diet, and ITG diet. A low carbohydrate diet is popularized by the nutritionist Robert, Robert Atkins in the late 20th century and the early 21st century. Proponents argue the approach of more successful way of losing weight than the low caloric diet. The critic argued with the low carbohydrate approaches the forces equals to the health risk. You can diet, a multi-step of diet based on high protein with a limited amount of carbohydrate consumption. It starts with a two-step of intent to facilitate short-term weight loss, followed by two steps intended to consolidate these losses in terms of more balanced long-term diet. ITG diet. The third step diet is maybe limiting carbohydrate consumption combined with low fat protein to maintain muscle, but objective returning to healthy balanced diet for long-term weight maintenance. Next, coming to the diet, crash diet. Crash diet or fad diet are general term used to describe the things which is involved making extreme and rapid changes in the food consumption and but we're also disparaging the terms for common eating habits is considered as unhealthy. Both the type of diet are often considered to pose health risks. Fourth one is detox diet. The term detox involves either in consuming or attempting flushing out the substances which is considered unhealthful and harmful. Example, restricting food consumption, the food without coloring or preservatives, taking supplements, drinking large amount of water. Later practice, particular is wrong, has drawn criticism as drinking significantly more water than the recommended, which reduces hyponatremia. Juice fasting, a form of detox diet, which is nutrition obtained solely from the fruits and vegetable juices. Next, diets we follow for the medical. Some of the medical reasons, some of the diet which is intolerant for a specific condition, allergic condition of certain types of food. There are also dietary patterns may be recommended, prescribed, or administered for the medical professionals with specific medical needs. A DASH diet, a dietary approach to stop hypertension. A recommendation of those high blood pressure consumes large amount of fruits, vegetables, whole grains, low-fat dairies as a part of their diet and to avoid sugars, sweetened foods, and red meats and fats. The elemental diet, the medical condition, which includes liquids diet, only liquid. In this, liquid nutrients are consumed for ease of digestion. Elimination diet, a method of identifying the food which causes adverse effect, that is, causes food allergy. This is the process of elimination. Next is gluten-free diet. The gluten-free diet indicates the diet which avoid the protein gluten is found in barley, rye, and wheat. It is also a medical treatment for the celiac diseases too. Gluten-free and casein-free diet is to avoid the gluten-free diet, which also avoid casein protein, commonly found in the milk and cheese. Coming to the other diet, which is low-fat diet and low glycemic index diet. Low-fat diet, which restricted of saturated fat of lowering to 35 to 40% of total calorie and 15 to 20% of total calorie have been shown and decreased of LDL cholesterol by 10 to 20%, however, to in reduction in the saturated intake. Coming to the low glycemic index diet, a selected food on the basis of minimal alteration of circulating glucose level. GI diet is a glycemic load and which measures the effect of glucose level after food containing carbohydrate. Based on this data, the low glycemic response has been associated with the type of diabetes management, improve blood lipids, reduce risk of not only the food will to ensure the low glycemic index, it take them longer to digest their food. Prolonged satiety will also maintain the glucose level at a relatively constant state. The food with a high glycemic index not only digests quickly, also causes extreme fluctuation in the blood glucose level. Second thing, we are going to see about the routine hospital diet. In routine hospital diet, we have clear fluid, full fluid, or a fluid diet, or a soft diet, or normal diet. First, we are going to see about clear fluid diet. Clear fluid diet is temporary diet, clear liquid without residue and non-irritating, non-stimulating, and non-gas forming substances. Small amount of fluid that is usually 30 to 60 ml are served at the frequent interval of 2 hours to replace fluid and electrolyte to relieve thirst. Being composed of mainly water, carbohydrate, and some of the electrolyte, clear fluid diet can be normally provide 400 to 500 kilocalorie, 5 grams of protein, and negligible amount of fat, and 100 to 220 grams of carbohydrate. It is nutritionally intake, therefore, used for a short period of 24 to 48 hours. The disease condition for this clear liquid diet is used for any preoperative condition for preparation of bowel surgery, prior to colonoscopic examination, post-operative patient initial recover phases after abdominal surgery, a period of intravenous feeding, acute illness, infection, and acute GI disturbances, acute gastroenteritis, when the fluid and electrolyte replacement is necessary to compensate losses from diarrhea. And the step for first of oral alimentation of nutritionally for delivery patients and for the temperamency food intolerance to relieve from thirst and to reduce the colonic fecal matter. Next, coming to the full fluid diet. This diet, which includes liquids, which is mainly a full fluid, maybe a transparent thing or a full fluid diet. It is free from the cellulose of irritating condiments and spices. This diet is properly planned to make the nutrition adequate for maintenance requirements. It is used for more than 2 days. Then the high protein caloric supplements will be necessary. This diet, which will just a graph between the clear fluid and soft diet. The average nutritional composition of this nutrient diet is 1200 kilocalorie, which contains of 35 grams of protein. This should be in the interval, this should be taken in the interval of 4 hours. Disease conditions for use for this full fluid diet, the most often the patient which is post-operatively and progressing to clear liquids to solid. And next is the patient who is suffering from acute gastritis and breather infection following oral surgeries and plastic surgeries of face, neck area, etc. The third one is soft bite. The name itself indicates it's very soft. It's usually the transitional period and transitional diet between the full food and normal diet. It should be nutritionally adequate. It should have a soft consistency, easy to chew, made up of simple and easily digested food containing limited fiber, connecting tissues, and does not contain rich high flavor foods. The average soft diet supply 1,800 to 50 gram of protein. Coming to the, however, the higher protein and other nutrients are adjustable according to the needs, the activity, according to height, according to the weight, and sex, age, and disease condition. It can be given as a clean meal with or without meal feeding. For the patient who should consume the soft diet or the patient are progressing from full fluid to the general diet, post-operative patient who is unable to tolerate general diet, patient with mild GI problem, weak patient or patient with inadequate definition to handle all general diet, diarrhea, convalescence. Between the acute illness and convalescence period, the diet should be followed. The acute infection, soft diet can be modified as a mechanically soft diet. Many patients require soft, simple, but they do not have teeth, such as diet should be followed with a mechanically or a dental soft diet. It is desirable to restrict the patient to select the food and customary soft diet for the following modification diet may suffice. Vegetables may be chopped, diced before cooking. Hard fruits and vegetables are avoided. Tough skin seeded are removed. Nuts and dry fruits are to be chopped and powdered in the form. And meat has to be finely minced and ground. Soft chapati bread can be given. In table one, we have discussed the list of foods to be allowed in the cases of soft, full, and liquid and clear liquid diets. Disease condition uses are in the case of limited chewing and swallowing, and the patient who undergone head surgery, neck surgery, and patient who have dental problem, and some of the anatomical esophageal stitches patients can follow this mechanically soft diet. And this is the table which is prescribed the form of food groups, maybe cereal, what cereal to be taken as a soft diet, what cereals to be added in the full fluid and what on the clear. Coming to the cereals, it's refined in case of soft, whole grain, bread, biscuits, semolina. In the case of full fluid, gruel, porridge, kanji, ragi malt. In the cases of mm, clear liquid, the cereal product is barley water. Coming to the pulse, for the soft diet, all dal can be taken for full fluid in the form of dal soups, dal payasam, or in the clear fluid, dal water can be added in the pulse infusion. Vegetables and fruits, all strained vegetables and soft fruits like banana, papaya, baked puree can be added, and strained juices can be added, and clear juices can be added in the clear. Milk can be added, milk and milk product, and milk beverages in the full fluid diet, whey water in the clear fluid diet. Butter, margarine, oil in the soft diet, butter, margarine, cream in the full fluid diet. Fat should be avoided in the clear liquid diet. For in the case of meat, only soft diet can allow the tender meats, lean meat, poultry, fish, etc. For the both cases, we should avoid fish, meat, and fish. Egg can be taken in the case of soft diet, which should be all except right. In the case of full fluid, only beverages, egg white well beaten in the fruit juices, sugar and jaggery, and can be used in soft diet, honey, sugar, jaggery for full fluid, and nothing can be added in clear fluid. So soups and desserts, all custard, kheer and pudding, strained custard ice cream, plain, coconut water, part-free broth and gelatin can be added. Next, coming to the normal diet is nothing but the patient can keep on taking all things of food groups in the optimum amount of nutrients are provided. As there is no restriction any kind of food is taken, a nutritionally adequate thing to be taken. Patient who is hospitalized or bed rest, 10% of energy intake should be right, and fats and fried food should be avoided. Coming to the cold and semi-liquid diet, this should be given for the patient with colonoscopy, throat surgeries are performed with a soft and general diet swallowed without difficulty. It should contain cold beverages with a lukewarm preparation. Next is the blenderized liquid diet. This should be adopted the condition the patient was inadequate at oral control, who undergone oral surgery with dysphagia, wired jars, and blenderized food can be consumed in small portionings. The patient with reduced pharyngeal peristalsis, this blenderized thing can be added. And routine food is made up of liquid pulp can be prepared by using kitchen blender. Special. Coming to the feeding methods, there are two types of major methods according to the disease condition. The different modes of feeding patients are enteral and parenteral. Enteral, by the definition, the enteral means by, within, or a way of gastrointestinal tract. As far as possible, the patient should be encouraged to ingest the food through oral food. Supplements may be added whenever necessary. Food is administered through tube is called as tube feeding. Maybe this is passed to the stomach, that is gastrogastritis, nasoduodenal, or through the jejunum, nasojejunal. When the obstruction of the esophagus, the feeding will be done by passing the tube surgically by the insertion of abdominal wall, as gastrectomy or duodestomy or jejunostomy. This is an indication of tube feeding may be followed for the patient who is unable to swallow or unwilling to eat, persistent of anorexia due to force feeding, semi-conscious or unconscious patient may be put on tube feeding, several malabsorption requiring administration, unpalatable formula for a short bowel syndrome patient, and the baby have low birth weight. The tube should be very thin. Tubes are usually adequate, and prolonged use of specially prepared tubes is desirable. The procedure to be administered by intragastric tubes. Their connected tube is allowed to the drip into the stomach by the gravity. The feeding can be started as continuous drip of 50 ml per hour and increased by 20 ml every hour, 24 hours until required as rate of flexion. There is evidence of giving intermittent bolus feeding for every 2 hours to improve the metabolism compared to feeding by continuous dripping. Enteral feeds, the type of foods can be administered are blenderized feeds, polymeric mixture, and elemental diets. Blenderized foods is nothing but the well cooked and blended foods with a special food blendering thing. This can be given to the patient who doesn't able to chew or swallow due to oral cavity cancer, etc. Polymeric mixture is a mixture which containing intact of protein, fat, carbohydrate, high molecular weight, thus the lower of osmolarity. Elemental diet, which is given as a commercial pre-digested mixture of amino acid, dextrin, sugar, electrolyte, vitamins and mineral, and small amount of fat will be added. This is lactose free, which is can be administered very easily to the patient. This is coming to the method of feeding. There are three different types of methods. One is continuous, intermittent, and bolus. Continuous administration by drip, it is adjusted according to increment of preventing cramping, nausea, diarrhea, distension. Feeding started with 30 to 50 ml and every hour up to 8 to 12 hours until the final rate is attained. Intermittent drip, in this 4 to 6 feeds are given with the regular periods of interruption. 4 hours will be in on condition and 4 hours in off condition. The bolus method is a large amount of volume can be fed in a short time. For example, 200 ml can be administered at the minimum time of 10 minutes. So, depending upon the condition of the patient, the method of feeding administration should be followed much correctly. And enteral feed. Coming to this parenteral nutrition, this is second types of feeding method. The delivery of the nutrients or through peripheral terms is parenteral nutrition. This is also called as sleeping, that is total parenteral or supplemental nutrition, which provide 30 to 50% of total daily nutrient distributed by this is also called as intravenous feeding. The patient who cannot eat, not eat, should not eat, cannot eat any amount of feed is adequately by tube feeding. So whereas tube feeding is failed, the patient can immediately put on the intravenous parenteral feeding. The condition which necessitate TPN feeding are cancer, IBD, short bowel syndrome, preoperative patients, and gastrointestinal fistula patients. The parenteral feed solution, which contains of higher osmolarity, results in thrombosis and high inflammation of parenteral feed solution contain glucose, emulsified fat, crystalline and amino acids, vitamins, electrolytes such as sodium, chlorine, phosphorus, potassium, calcium, magnesium, trace elements such as zinc, chromium, magnesium, iodine, and water. These are the composition of the parenteral feed solution. And coming to the advantage, coming to the advantage of the particular feeding, that is enteral parenteral feeding, convenient to administer, inexpensive, no hospitalization, no sterilization, no tube nutrients, and no expert supervision is not necessary, easily tolerated, avoid catheter, related sepsis and infection, avoid metabolic disturbances, intestinal mucosa regenerate, and most rapidly of short bowel syndrome. This is about advantages of enteral feeding. And coming to the food exchange list, the food exchange list consists of similar group together to the specific foods of each listed approximately of energy, carbohydrate, protein, and fat content. So any one of the particular food exchange can be list of exchange food of the same list, which facilitate a wider choice in selecting foods from every exchange while controlling the total calorie, protein, fat in the daily diet. 9 food exchanges has been listed here. Vegetable exchange A, vegetable exchange B. Vegetable exchange A include less carbohydrate of 100 grams of vegetable to make one exchange is negligible fat and protein, which includes leafy vegetables and gourd vegetables. So vegetable B, which is high carbohydrate content of 7 grams of carbohydrate. About examples of beetroot, cauliflower, carrot can include in this exchange, which provides 10 grams of carbohydrate, 2 grams of protein, and negligible fat and 50 kilocalorie. Fruit exchange, this provide an average amount of carbohydrate, negligible protein, fat, and 50 kilocalorie. Cereal exchange, a quantity of cereal products of 20 grams of carbohydrate is taken as one exchange. Each cereal exchange provides 20 grams of carbohydrate, 2 grams of protein, negligible fat, which provides 100 kilocalories. Pulse exchange. The basis of exchange of 30 grams of raw pulses containing 6 grams of protein. The quantity of pulses providing 6 grams of protein taken as one pulse exchange. Each pulse exchange provides 6 grams of protein. The negligible fat, 15 grams of carbohydrate. It also provides 100 kilocalories. Flesh foods, one meat exchange provide 10 grams of protein. The negligible carbohydrate and 70 kilocalorie. The quantities in this exchange vary from 50 to 60. This is on the protein. Milk. Coming to this, the quantity exchange is constant in various carbohydrate and fat. So it provides protein that change of 100 kilocalorie for this exchange protein content for this time. Fat exchange. The fat exchange include butter, edible oil, cream, nuts, and oil seeds. One exchange in this list of the quantity will provide 11 grams of fat on an average. Fat exchange will provide 11 grams of fat and 100 kilocalorie of negligible protein. This sugar exchange, this includes sugar, jaggery, honey, jam, jellies, and marmalades. Each sugar exchange is list provide on an average of 5 grams of carbohydrate and 20 kilocalories. So, in short, today we have seen about the basic principles of therapeutic diets and routine hospital diets. To summarize, we have seen about what and all the therapeutic diets to be followed, with what and all the conditions, and what patients, and what the administrative dose, and what and all the cases, and what types of feeding methods to be followed. In the second phase, we have seen about the routine hospital diet and what are the different types of diet, clear diet, soft diet, full fluid diet, and normal diet. Which condition is diet to be administered and for which patient to be administered and what types of 9 types of glorification to be exchanged first to be. Thank you for the listening patient. We go for the oral quiz. You can post your answers to this oral quiz from the comment boxes. We'll go with the 5 questions today. So what is therapeutic diet? What is therapeutic diet? A diet with full of dietary supplements, a diet with full of medical supplements, a diet with a normal diet with little modification. Second question, give an example of a soft diet. Example, option A, idli. Option B, porridge. Option C, soups. You can post your answers in the comment box. The other name for enteral feeding. Third one. The other name for enteral feeding is TPN, PTN, tube feeding, parenteral feeding. Fourth question. For the enteral feeding, supervision is must. State true or false. The enteral feeding, supervision is must. State true or false. The last one. For the full fluid diet, the requirement of protein is about 20 grams, 30 to 35 grams, 40 to 45 grams, 50 to 50 grams. The full fluid, which provides a protein 20 to 30 grams, 35 to 40 grams, 40 to 50 grams, 55 to 60 grams. Thank you all for the patient listening. You can post your answers in the comment box. Thank you.